Who was the ghostwriter?
There's a woman called Sheena Hunt
Sheena
who
Hunt.
lives in New Zealand
And
at the Pfizer
what
trial.
does she do? Like, why was she the ghostwriter? What's her background?
Well, most ghostwriters, as I said, are PhDs,
Yeah, yeah.
and the ghostwriting issue. Let me just bring out a point here, which I think is nice. The ghostwriting issue became a big deal around 2004, when, with the trials done on antidepressants in kids, it became clear that every publication said that these drugs worked. And the data when we got hold of it, including the Prozac data in kids, was negative.
Hmm.
Okay. And it was also clear that everything was ghost written.
Yeah.
Okay. So there's a big fuss about ghostwriting. And the problem has been solved by including the names of the ghostwriters in small print at the
Wow.
end of the article. But
Wow.
that's seen as the solution. I mean, people were saying the problem with ghostwriting is you're not letting, I mean, you're making the ghost a ghost. You know,
Yeah, yeah,
nobody gives them any credit of any sort.
yeah.
So we're just going to mention the name in
We're just
small
gonna
print at
name the
the end.
ghost, and yeah, now it's all out
But
there.
when, yeah, but we aren't getting to grips with the
Right,
fact that the important commercial messages are
right.
still
They're
going to be
still there.
there.
Yeah.
Yeah.
Um,
Yeah. So,
do you have a hard stop at the hour here?
not exactly a hard stop, no, but
Okay.
at some point I'll
Yes.
be
I
hoarse
just want to
forever.
ask you one more question, one more
Mm.
topic, and I'll let you kind of steer it. But this is something that people wonder about and speculate about, I think, reasonably, and that's the issue of suicides and violence and how that relates to SSRIs and maybe related drugs. One way this manifests that I've seen this in social media, for example. Obviously we have a mass shooting problem. They're happening at a higher
Mm.
frequency than they used to, certainly. I remember being in fifth grade when Columbine happened, and that was like, the first
Yeah.
big one. And then, they just became
Mhm.
more and more common. I hear about them, all the time now. You'll often see on social media, for example, people will post, a collage of like 20 faces, and they'll say that they're all on SSRIs or antidepressants of some kind,
Mhm.
and try to make the case of, well, there could be a relationship here. And you could say, okay, well, maybe they just cherry picked examples, and this hasn't been systematically studied. What
Mhm.
can you tell us at a high level about SSRIs, violence, and the potential connection to things like mass shootings? Is there a connection here? What should we know?
Yeah, there is. Let me preface this by saying, first of all, I prescribe SSRIs. I don't not. Okay. I'm not into other kinds of therapy. I'm into using drugs to help people where appropriate. The, the being able to use a drug means knowing when not to use it. And it means knowing when actually to halt it, when it isn't suiting a person.
Yeah.
Okay. Maybe switch to nicotine or whatever. Okay. But The yeah, and in terms of people actually becoming suicidal on SSRIs, first of all, one of the difficult things for companies and anyone to explain is the healthy volunteers who've actually gone on to commit suicide on these drugs in very brief trials. Uh, People who are normal, deeply Christian, totally against the idea that that I might kill myself, who kill themselves on these drugs
Hmm.
and kill themselves
Mhm.
withdrawing from the
So it's
drugs.
not just people who are already on the brink or who had attempted suicide
No,
before.
no,
Yeah.
no. People who are going to college need a bit of money to help pay the fees or whatever, pretty healthy people. Yeah. So, in terms of people who have gone on to commit suicide or gone on to commit homicide, I'm actually the best person that a pharmaceutical company could use in terms of defending themselves, in the sense that if I interview a person who's been on a drug and has gone on to commit homicide or whatever, uh, believing that the drugs can cause this, if I say no, the drug hasn't caused it in this case, I'm going to be more credible than an expert who says, oh no, these drugs can't cause a problem. Because juries faced with cases like this have said, well, we're not going to believe the experts, we're not going to believe the company, we're not going to believe the published articles. It's very, very clear. I mean, juries of lay people have actually concluded it's very, very clear that the drugs can cause a problem.
Mhm.
Judges and prosecutors have quietly agreed with the uh, a defense that yes, the only way to explain this man killing his wife was the influence of the drug he was on. Okay. Now, in terms of all of the mass homicides and things like that, where people have claimed the drugs have been involved, um, we have a big problem, which is the person who's shot everyone is usually dead as well. The one
Mm.
case where this hasn't happened has been James Holmes, the Batman Rises, the
In the movie theater
Dark
shooting.
Knight Rises, the Aurora, Colorado
Yeah.
shooting.
Yeah.
Holmes was a quiet, shy university student who was put on an SSRI by the I forget the name of the university he was in, but by one of the doctors in the university, he becomes disinhibited and much less shy, and begins to keep a diary and gives a great description of the effects of SSRIs on him. He's becoming manic and disinhibited, and he buys a motorbike, he buys guns, he goes to a shooting range and starts shooting.
Hmm.
Never had done any
Hmm.
of this before.
Basically, his whole
Uh,
personality changes.
yeah, yeah. And he starts thinking and talking about plans to shoot a bunch of people. He goes along to his doctor, who increases the dose of the pills, who he says to her, look, if you knew the thoughts going through my mind, you'd lock me up. And she looks at him and says, well, you're responsible for what you do. She doesn't think the drug could be causing the problem.
Right.
Okay.